My name is Paul Cockwell. I'm a consultant kidney doctor based in Birmingham, UK, and I'm the outgoing president of the UKKW Association. There's multiple highlights. A thing that really captures me is the energy and the sheer quality that we see with a lot of the poster sessions, where you've got small groups of engaged people who are focused on areas of interest to them, with really high quality presentations by colleagues from across the UK, multi-professional medical, who've been working so hard to put together evidence that lifts us to be able to provide better care for patients with kidney disease. The other thing that's really stood out for me, we're now halfway through the second day, is the quality of the plenary sessions, which have been inspiring, both in the way that the speakers have presented their background, but also in the way that they challenge in some of the paradigms as to how we think about risk and how we think about how we talk to people with kidney disease. And then a real standout this morning was the presentation of the first Lifetime Achievement Award from UKKW Association. That was to Dwomoa Adu, who has had a career of contributing, developing, mentoring, supporting and providing evidence, and told us the recent part of his journey, which is an inspiring story of defining the genetics of ApoL1 in people of Sub-Saharan Africa, and really adding to what we know about that particular area. So despite the fact that we're in an incredibly exciting time in terms of the development of therapies and new options for people for kidney disease, the real focus now for us as an association has to be on how we get key messaging around the inequalities of care for people with kidney disease. And there's some real signals, not just in the UK but internationally, that access to treatments is a challenge and that gap's widening. So if you're of lower socioeconomic status, or if you're of certain demographic, ethnic groups, then you're less likely to access care. And if your kidney disease is more advanced, you're less likely to be offered disease-modifying treatments. And how do we really work in our systems to ensure that each area is supported properly to make the case for what they need in terms of resource, for leadership, and for care pathways for people in each of their systems, in each of their localities. So that for us is a huge challenge. We spent a good deal of time talking as a leadership group as to how we really frame that for the membership and then frame that for the broader community. And I think a lot of the work we're going to be doing the next year or so in terms of policy isn't going to be about advocating at a political level, but actually advocating into each system so that we get some accountability for how integrated care boards and how broader health leadership systems in the devolved nations are held accountable for helping to provide high quality care for people with kidney disease.